Varicose veins, how they form and what natural remedies relieve the symptoms. Varicose veins are also called varicose veins and are most often a result of poor blood circulation to the leg. In fact, any vein can become varicose, but the veins in the legs are most commonly affected. This is due to the fact that the man stands and walks in an upright position, and gravity causes the pressure to increase in the veins of the lower limbs. Chronic venous insufficiency is present in 60% of the adult population, according to a recent study. The condition also occurs quite frequently in young people, being generally underdiagnosed. In females, the disease has an incidence 3 to 4 times higher compared to males and generally occurs after the age of 30 years. But we must differentiate between varicose veins, which are palpable and cause swelling of the skin, reticulated veins, thin veins that are not palpable and are usually found on the upper skin. For many people, varicose veins and reticulated veins are simply a cosmetic concern. For other people, varicose veins can cause pain and discomfort, and sometimes they lead to more serious health problems. What are varicose veins and how do they form? As I said, varicose veins are wide veins, prominent, palpable and visible on the surface of the skin, on the thighs and legs. The term usually refers to the veins in the leg, although varicose veins can also occur in other areas of the body. The veins have valves that help the blood to travel in one direction. The mechanism of the leg pumps the veins to push the blood to the heart, skeletal muscle pump, against the effects of gravity. If the walls of the veins become stretched and less flexible, elastic, the valves may become weaker. A loose valve can allow blood to flow back and eventually it flows in the opposite direction. When this happens, blood can build up in the vein, which then enlarges and swells. Varicose veins present for a long time can lead to swelling of the foot, venous eczema, thickening of the skin, lipodermatosclerosis, and ulceration. Although life-threatening complications are less common, varicose veins can be confused with deep vein thrombosis, a life-threatening condition. Predispositions for the formation of varicose veins. Gender. Varicose veins affect women more often than men. Genetics. There is an increased risk of varicose veins in people who have family members with this condition. Obesity. Being overweight or obese increases the risk of varicose veins. Age. The risk increases with age due to wear and overlap of the vein valves. Some jobs. A person who has to spend a lot of time standing can be more likely to be affected by varicose veins. You can prevent the appearance of varicose veins through a healthy lifestyle that includes sports or regular exercise, a high-fiber diet and proper water intake, as well as eating purple fruits, blueberries, currants, blackberries, fruits rich in anthocyanins and proanthocyanins, flavonoids recognized for their positive effect on the cardiovascular system. Diagnosis. Specialists can diagnose chronic venous disease through physical examination of the person and other investigations, and then recommend appropriate treatment depending on the nature of the problem and the stage of development in which it is. Physical examination involves examining the affected limb or limbs, with the patient standing, to see if there are swellings, or sitting. The doctor will also investigate the symptoms the patient is experiencing. Doppler ultrasound is a non-invasive method to see if there is a valvular insufficiency, but does not allow to assess its severity. Phlebography is sometimes recommended. Being a complex method that requires experienced staff and uses contrast, phlebography is essential when considering surgery on the deep venous system. Varicography involves the injection of contrast material in the varicose veins. The patient is in a horizontal position, and the legs are held slightly above the level of the head. The method allows visualizing the trajectory of varicose veins and possibly highlighting that source. Can be combined with phlebography. Methods of treatment and improvement. Depending on the severity and duration of varicose veins, they may improve or opt for surgery, including non-invasive modern methods such as sclerotherapy and pulsed laser. Discomfort in the legs, heaviness, burning, swollen legs. Painful and unsightly veins are the first signs that often announce the appearance of varicose veins in the legs. If in women the symptoms appear more after maternity, only after 30 years. And it rarely happens that they develop earlier than that. In men, varicose veins are more common only after the age of 40 years. Symptoms can be relieved by medicinal socks, lymphatic massage or pressure massage, creams and gels with venotonic and antiphlebitic action. Natural remedies. Wild chestnut extract is known for its venous tonic action. At the same time, arnica, hot pepper extract or sorrel extract have beneficial effects in stimulating blood circulation. So they are often used in the composition of gels or creams recommended for relieving the symptoms of varicose veins. Grapeseed extract. Grapes. Grape leaves and grape sap have been used in alternative medicine for centuries. Research suggests that grapeseed extract may help treat the symptoms of chronic venous insufficiency. At the same time, this extract can reduce edema when certain tissues swell, but more research is needed. In a small study, the effects of a single dose of 400 mg of proanthocyanidin from grapeseed extract were evaluated, followed immediately by 6 hours of residence. The dose was shown to reduce swelling and edema of the feet by 70% in people who took the remedy compared to those who did not. Grape seeds contain vitamin E, flavonoids and other beneficial compounds. As a dietary supplement, you can find vine remedies in the form of tablets, capsules or as a liquid extract. Be careful, though. Grapeseed extract may interact with anticoagulant drugs and increase your risk of bleeding. Do not take this extract if you are being treated with anticoagulants, which thin the blood.